Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making.
Joining us today is Dominique Dyer from Philadelphia, Pennsylvania. Dominique recently graduated with her MPH from Thomas Jefferson University. With prior experience as a project manager at Janssen Pharmaceuticals, Dominique aims to pursue a career in policy, advocacy, or data analytics, working to address disparities in mental health access. Dominique graduated from the New to Public Health Residency program in September of 2024. Thanks for joining us today, Dominique. Can we start by having you tell us how has New to Public Health contributed to your personal growth as you are navigating a new career in public health?
Yeah, so a New to Public Health program contributed to my personal growth by enhancing my confidence. It empowered me to feel as if I can contribute to the public health field, and I can only credit this program to be one of my successes and influences as well. Meeting with other public health professionals in the cohort, I found a sense of community. I learned that I was not alone. I'm not on this new journey of entering into the public field alone. So that was very valuable, and it helped me to feel comfortable communicating about public health in professional settings.
So as you were doing the New to Public Health program, you also were getting your master's in public health. Can you talk about that and that educational journey for yourself?
Yeah, sure. So I found my passion in public health because I wanted to impact communities, especially marginalized communities, addressing equity in our system. And I was in my MPH program while being a part of the program, the New to Public Health program, for a year. And I was able to apply the curriculum that I learned in this program to my education and my classes in my school program. And it really helped me link public health together and see things in a holistic way about the field. And it definitely increased my knowledge to how to communicate public health to an audience that may not know what it is.
So as you have now both your MPH and have completed the residency program, what does that look like for, prospective employers, or how are you putting that on a resume, and what are the reactions that you're getting from people?
Yeah, so the program has definitely enabled me to receive many job prospects and employers reaching out to me to for me to have an interview with them. And it has been like a resume booster. During interviews, a lot of the employers are interested that I participated in a residency program, because when you think of residency programs, you think of medical students, nurses, nursing students, and public health it's not as common. So putting New to Public Health on my resume has definitely boosted my value to employers.
Great. We love to hear that. And, our program is based in the same science and research that those nurse residency programs are based in. So, it's great that employers are finding that valuable.
Something else that I
hope is valuable to employers and for you to talk about in interviews and put on your resume is the evidence-based practice project that you complete for the New to Public Health Residency program. Could you talk to us about your project?
Yeah, so my final project in this program was to design a process improvement plan. And during my graduate program, MPH program, I was a part of various public health organizations, advocacy clubs, and there was one program in the student organization I was a part of that I felt had areas of improvement. And I was able to identify the gaps in the program using my curriculum from New to Public Health, being able to assess whether it is feasible, sustainable, and how to improve moving forward. So I did do some research, evidence-based research, of course, using journal articles to use the knowledge to advocate for change in the program. And it was successful. The program was, it wasn't as prioritized in the club. And the curriculum, the project kind of allowed me to think strategic and how to communicate research, evidence-based research to audiences that may not be familiar with the public health theories that we've learned in this program.
Yeah, that's super important, right? In working in the field of public health is communicating the science in ways that people understand. I am very excited to hear that you were recently hired into a new position. Can you tell us about your new job, what you'll be working on, and most importantly, what you're most excited about doing in this role?
I was recently hired as a GME institutional coordinator. GME stands for Graduate Medical Education. I'm currently working with residents who are also known as physicians in training, seeking to specialize in family medicine. In this role, I will lead efforts of program monitoring and evaluation in the support of wellness initiatives for the residents in the family medicine program. I am most excited about working with the residents and collaborating with other programs that the hospital manages.
Well, thank you so much for chatting with us, Dominique. It's really wonderful to hear what you feel the program has brought to you and your public health experience, and also to hear about all those awesome things that you're doing now. And we wish you good luck moving forward into the future.
Thank you very much, and I greatly appreciate all of the facilitators and the educators and the program managers, as well as the specialists, and being able to create this environment where emerging public health professionals can come together and learn from one another, as well as grow professionally and personally. I definitely am so grateful for this program, and I would definitely recommend it to other emerging public health professionals, and even people who are in their graduate studies as well. So thank you.
Thank you so much. Thank you for listening to Field Notes, insights from New to Public Health alumni. For more information on the New to Public Health Residency Program, visit new2publichealth.wisc.edu. Thank you.